Mahatma Gandhi, an Indian lawyer and political ethicist, is quoted to have said, "Sanitation is more important than independence." My name is Hazardous Babalola, a pharmacist by profession, but a public health practitioner by passion. Public health can be defined as the art and science of promoting health and well-being, protecting health, preventing ill health, prolonging life through a set of organized efforts, which may be interprofessional collaboration, intersectoral collaboration, and community involvement participation. As a public health pharmacist, I promote, protect, prevent, and prolong health of the populace through my knowledge of pharmacy. I'll be talking on the topic, the hazardous effects of medicines on our environment. Medicines are used for prophylaxis, diagnosis, therapy of diseases, and modification of physiological functions. The use of medicines in man and animals is escalating daily. Consumed medicines pass out of the body system as metabolites or unchanged through excretion. Most medicines are water soluble, so easily enter into waterways, into sewages. Industrial waste of companies also contribute towards the entry of drugs into the environment. Most industries treat their sewages before disposal, but most of the processes leave traces of these medicines entering into the environment. Different countries have reported trace quantities of medicines in water in the environment. In the Niagara River, antidepressants, carbamazepine, anti-epileptics, and lipid regulatory agents were detected. In Po River in Italy, cocaine was detected. Antibiotics like fluoroquinolones have also found their way into the waterways in trace quantities in the environment. Hormones also found, which lead to sterilities of fish and frog in water bodies. Trace quantities of paracetamol and diclofenac has also been found in water in the environment, and this adversely affects the health of the populace in different ways. Now, improper disposal of leftover medicines is another dominating cause of environmental contamination and is a huge public health concern. Availability and prompt access to medicines is very crucial for effective healthcare delivery, but disposal of leftover medicine has not been greatly thought out. Leftover medicines can be as a result of patients stopping their medicines due to adverse drug reactions that they experience. Some patients stop medicine because they feel well. Some medicines get damaged. Now, improper disposal of these medicines leads to them getting into the environment. Continuous exposure of these low doses of antimicrobials can lead to resistance. Special populations like pregnant women, pediatrics, geriatrics, people with renal or hepatic insufficiencies remain at a greater risk to such exposures because in these categories, the pharmacokinetics get altered and minor doses may show synergistic actions, so may present with nocebo effects, even in subtherapeutic doses. A few of these effects are seen in studies. Now, diclofenac, an anti-inflammatory agent and a painkiller, was introduced around the end of the 20th century in India, Pakistan, Nepal, and Bangladesh to treat sick cattle. But when the cattle carcasses were eaten by vultures, the birds developed fatal kidney conditions. Within a few years, vultures' number had declined by a staggering 99.9%, letting carcasses decay in the environment instead of these birds eating of these carcasses of the environment. Progesterone and hormonal preparation used in contraceptives, cancer treatment, and hormonal replacements are found in different waterways in a number of countries and are known to cause sterility in frogs. The African clawed frogs serve as a model organism. It is during the tadpole stage that the development of frog reproductive organs begin. Now, the process is governed by the hormone system. Female tadpoles that swim in water containing low concentration of levonorgestrone exhibit a great proportion of immature ovarian egg cell and lack oviducts, leading to sterility. Studies abound on the harmful effects of drugs on our environment. Now, the next time you take medicines from a pharmacy, ask how you can dispose of these medicines if you don't use them all. There are take-back medicine programs whose aims are to provide safe, convenient, and responsible means of disposing of prescription medicines. Now, the next time you take medicines from your pharmacist, do not leave the pharmacy without understanding how everything you need to know about how to take your medicines, how to store them, and to dispose of them properly if you do not finish using your medicines. And education on information and program targeted at the disposal of medicines will go a long way to rid the environment of harmful medicines. I hope this will go a long way to help us rid our environment of harmful effects of these medicines. Thank you.